AED procedure, child and infant.
And it's okay, baby. Turn it on. Open up the fast response kit.
Remove clothes from patient's chest.
Now I know that it's an infant. All right, so there's a key, child key, infant. I'm gonna plug that in there and change the directions for me.
Infant child mode.
Okay.
Remove clothes from patient's chest.
I haven't done that to
When
anybody
patient's
yet.
chest is bare, open gray plastic case. Look carefully at the pictures on the infant child key. Peel one white pad from the gray case. Place pad in center of child's chest. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad on child's back. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised.
I am
Stay
clear,
clear
you're
of
clear,
patient.
stand clear.
Press the flashing orange shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR.
Keep with me.
For help with CPR, place the heel of one hand
It's not the
in
heel.
the center of the chest, between the nipples. For
Fingers.
patients less than 1 year old, use 2 fingers instead of the heel of your hand. Push the chest down firmly. Keep time with the beat. Pinch nose, tilt
Okay,
head,
rotate the
and
mask.
give 2 small breaths. Breathe.
Chin where the nose goes. Sniffer position.
Breathe. Continue with compressions.
Gently tilt head back.
And
2
that's it.
puffs of air,
Run
1
through.
puff per second.
Say no
Look
shock
for
depressant.
subtle chest rise. Continue with compressions until EMS arrives. AED procedure, child and infant.